Welcome to our virtual event on the state of the United States fight against AIDS. I'm Caitlin Owen, Senior Policy Reporter for Axios, and I'm coming to you today from the Axios headquarters in Arlington, Virginia. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and Axios.com. You can join the conversation today on Twitter with @Axios and hashtag Axios Events. Over the next 30 minutes, I'll be joined by my colleagues, Dave Lawler and Adriel Bettelheim, and we'll examine the progress, challenges, and priorities of the fight against AIDS in the US and globally. I'm excited to welcome our first guest today. She's the Speaker Emerita of the House of Representatives and the Congresswoman from California's 11th Congressional District, Nancy Pelosi, joining us from Washington, D.C. Welcome, Madam Speaker.
Well, thank you so much. I always welcome the opportunity to talk about HIV and AIDS and the need for us to be persistent and continue our work on it.
Well, let's start by jumping right in with your experience. You were elected to the House at the height of the AIDS crisis, and you were outspoken about it. This was an issue that at the time wasn't getting much congressional attention, and as President Biden has put it, talking about it and taking it on was viewed as a political death sentence. So why did you make it one of your key issues?
I didn't make it one of my key issues. It was the key issue in our community. In the early 80s, this thing emerged in our hospitals there, UCSF in particular, that sort of had resembled something that might have happened in the Middle Ages. It had no name. It was a horrible thing, and it took its toll on our people. We were losing friends, going to 2 or 3 funerals a week, sometimes 2 a day from it. So we took a big bite of the wormy apple that would later be called HIV/AIDS. The community responded in a very community-based way, whether it was care, prevention, or research. And we felt I, as the representative in Congress, had a real responsibility to advance the cause.
Well, so here we are decades later, and a lot of legislation later, but there's been mixed progress on the issue. Can you reflect a little bit on that progress and the obstacles that we face today?
Well, when I came to Congress, if you had ever told me 36 years later we would not have a cure or a vaccine, I would have found that very hard to believe, because we had great scientists and we had great need, and it just was so urgent. Okay, so here we are. We come then. I come the first day. They tell me don't speak when you're called upon, when you're sworn in as speaker. Just say yes, I support and defend the Constitution, but nothing else. Then the speaker says to me, would the gentle lady from California, the new member, wish to address the House? So these same people said, be brief. Nobody wants to hear from a new member. So I get there and tell them I've come and thank my constituents for sending, my parents for being there. And I said, when I came here, I would tell you that I came to fight against HIV and AIDS. That was that, very brief. And the people who had said be brief were really concerned, because they said, why would you want the first thing anybody knows about you here to be about HIV/AIDS? Which was really heartbreaking for me, because I was talking about prevention and care and research. We didn't have really discrimination in our community, but I could see the remnants of it. Not that my friends there were discriminating, they were just concerned about the other people. So I knew that we had an additional challenge in addition to the funding for all that was there. So that's how I started here. I got on a committee of jurisdiction that was helpful for me to advance the cause, thanks to Henry Waxman, who was a champion on this subject. Our community we were blessed with great scientists, great doctors, great care and concern and love for the people who were affected. So we had ideas. So, for example, one of the major bills that we would be putting forth was the Ryan White Care Act. it largely sprang from our prevention, care, and research, which were all community-based. It's really important to keep emphasizing that. And one of our first parades that we had, a march, a candlelight vigil, was the global mobilization against AIDS, so HIV/AIDS. So we recognize that, as personal as it was, and as local as our successes had been, that we wanted to make national, personal, local, national, we knew that to have a real solution, we also had to go global. So that's kind of the categories and the perspective. Think personally, act globally, and scientifically.
Right, right. And so one of those global initiatives is actually the President's Emergency Plan for AIDS Relief, or PEPFAR, as we call it. It's up for reauthorization in this Congress. It has historically enjoyed bipartisan support, but now some Republicans are claiming that President Biden is using PEPFAR funds to support abortion rights. Is PEPFAR reauthorization in jeopardy? And if so, what are the implications of that?
You know, it's heartbreaking to see that any excuse will do for them not to do the right thing. You know, we had this challenge in the beginning where we had to, when I came to Congress, we had a president who wouldn't even use the word, President Reagan. You're talking about President Bush and his great leadership on PEPFAR, which I'll talk about, but not before there's a lot of time in between. There's the whole night is a lot of time in between. And I want to salute the outside mobilization, because in our inside maneuvering, I say it all the time, we can just go so far. The ideas that spring from the community, the intellectual resource, the legislative approach that we are responsible for, but the outside mobilization, all of the groups that were so impatient, rightfully so, made such a difference. And that's how we got through increasing our funding into the billions of dollars, our authorization of legislation to move away from discrimination and toward solutions that recognized the dignity and worth of every person. Now we come into the 2000s and we have President, and as you said, a global initiative. President Bush was excellent on this, but so were the Democrats in the Congress, and it was bipartisan as well. I say that as one who was instrumental in the Appropriations Committee in saying, I said to Bono, and I said even to the president, we want PEPFAR, but we want it big. We don't want this as a project. We want it as a global initiative. To his credit, and I salute him. We just had the 20th anniversary in Washington, D.C., where he came, and he and Mrs. Bush spoke, and they both deserve tremendous credit. But so do the Democrats in the Congress, because we want it to be big. Now, let me speak about it. We had a president who was initiating it. We had a rock star, Bono, who was promoting it. And I said to Bono, no photo op without big. And then we had, just so much appetite to get it done in the right way. I visited Africa, and when I've been to many countries there, but the ones that I visited, the clinics on PEPFAR, I told this story with the president there a couple months ago, President Bush, that really poor people, they would come up to me and they'd say, I would never have gotten a test for HIV/AIDS were it not for PEPFAR. I could not tell my family that I might be positive unless there was a solution. So PEPFAR has given me the courage to come to the clinic, to take the test, if positive, to have a solution. That personal impact, I mean, over and over and over again, President Bush, I tell him that with great pride. Now, with COVID, I said to the head of the World Health Organization 3 years ago, right when COVID was new, I think, tell me how you see PEPFAR's impact, whether it's the scientists, whether it's the infrastructure, whether it's the clinics, the geography, the distribution, and it has been helpful in that regard as well. It has nothing to do with a woman's right to choose or abortion. That's heartbreaking. I mean, it's awful. So we know what we have to do for research, and why we don't have the solution I would like to have had, which is cure and vaccine. We have improved the quality of life enormously. Over the years, I would have people coming. I would meet with once a month. We had the meeting in San Francisco of people with AIDS, and it would be a situation where can you help me make out a will, or this, or we need this medicine from Spain. You know, we all the things to help alleviate the problems they were having and all that. And then with all of the new therapies and the rest, which are too many to go into in a short period of time, they were asking me, first they were asking me to help them make out a will, and then they were asking me to get them a job. It had all changed, all changed. In the meantime, in the 90s, we also established the AIDS Memorial Grove to have renewal and just a remembrance and renewal of the people we lost, but also the possibilities. There's so many people living with AIDS. I was there a couple of weeks ago for my own 36th anniversary. We always go each year and plant trees and all that. And so many of the people there are HIV positive, but they're positively doing just great in their lives because of the advances in science. None of it would have been as possible without the activism of the HIV community and those interested. So I keep saying it's the outside mobilization. It made all the difference for HIV/AIDS, but it was a model for other activism as well, whether it's breast cancer, it taught people really how to believe that you're different, you can make a difference, but you have to show up, you have to be vocal. And we owe a great deal to the HIV activism that was 80s, 90s, and really it continues, but especially the 80s and 90s making the big difference that it has. And President Bush, as I say, we just had an event. It was a couple months, I think it was May, so it wasn't that long ago. And he and former First Lady came, they both spoke, as did I, and we all shared credit, sang the praises of so many people who made it all possible. But we cannot have it be in doubt because of some cultural excuse that they may have. I even heard that it had anything to do with spending money on that. I mean, let's be serious about this, because it's not gone. We want to be AIDS free by 2030, but we're not AIDS free, and we can't use it. It has to do with other factors, I think, for those people.
Right. Speaker, thank you so much for those powerful memories. As we say goodbye, I can't resist asking you one question on the upcoming election. You are one of the most heralded political architects of our lifetime, and you know the country. A clinical question: if President Biden wins in 2024, it would be why? And if he loses, it would be why?
Oh, I think he will win. I think he will win because he's a great president. He has accomplished so much. Really, he has taken like over 10 million jobs created in the first 2 years of his term, cutting in half the unemployment rate. He has been historic in his addressing the climate crisis, which is a health issue, a jobs issue, a national security issue, and a values issue for our country. I think he will win because he has a great vision for our country. He's been around a while, and that experience counts for a lot of knowledge and judgment about how to get things done. He thinks in a strategic way about how to get things done and has been successful. And that's all intellectual, but from the heart, he is the most empathetic president. He has just been remarkable. So I have only to say that he will win, and he will win for a number of reasons. And it's pretty exciting. The only thing that can hold any of us up is if people do not vote. And what we have to do is fight the suppression of the vote that the other side is engaged in. They have no ideas about the future. They're just there to give tax cuts to the wealthy. And, I don't even go down that path. But what I am saying is how they win is by suppressing the vote. So if by some massive suppression of the vote, the Democrats do not prevail, it's not because they haven't done a great job. I'm very proud of what we did in the 2 years with the president, well, for a long time, but with the 2 years of the president and the new leadership and what they are going to do. And he's going to win because none of us deserves to win. But for what he has done, he has demonstrated that he can do better and more. And it's not about, well, I deserve it because I did this. No, it's about I can do more because I have done this. I'm very excited about Joe Biden for president. And we're going to win the House, and we're going to win the Senate, and we're going to win at the state and local level. Yeah, it's going to be good.
Well, Speaker, we are out of time, but thank you so much for the fascinating conversation today and for your decades of work on this extremely important issue.
I appreciate that. Thank you, Caitlin, for your interest, and I look forward to seeing it all in a couple of days. Thank you.
And next, over to my colleague, Dave Lawler.
Thanks, Caitlin. Our next guest is the CEO of the One campaign, Gail Smith. She's joining us today from Washington, D.C. Thanks for being here.
It's my pleasure. Nice to see you.
Nice to see you. So you've called the battle against HIV and AIDS a fight we can win. Where do the resources need to be focused in order to win this fight?
Well, I think one of the things to look at in answering that question is how far we've come, right? AIDS deaths have been cut in half. We've got more and more countries that are getting to the point where over 90% of their population that's HIV positive knows it, is on treatment, is virally suppressed. So we've got a huge amount of progress to build on. I think the last phases of this are going to require a few things in terms of where the energy needs to be. First, we need to keep up the political and financial commitment to get literally to the end of an epidemic, which is within sight and doable. I think second, we're going to need to focus on those populations that it's the hardest to reach. It's often very, very young women who are married at a young age, or girls that are put into a forced marriage that are in essence in hiding. People who are hard to reach because they may be in conflict zones, they may be in politically oppressive environments. We've really got to get to that population to get us to the finish line.
So you've mentioned that this is an area in which progress is being made. There are multiple other fires, even in the public health space, that have really taken attention away from HIV and AIDS. Perhaps
Right.
people say, okay, that's already going okay. Let's shift our focus here. How do you make the case that this is still the topic that requires, or at least a topic that requires intense focus, lots of resources, and how do you convince policymakers that this is still where their attention should be?
I'd say there are three reasons. One is that when we're this far along, to give up now, I think would not only do damage to a lot of people and to the cause, but would do damage to ourselves. We have led this effort as the United States across administrations for 2 decades. So giving up in the last mile just doesn't make any sense at all. I think the second thing is one of the things that became very, very clear during the pandemic is that all the work that's been done on HIV and AIDS by PEPFAR, by the Global Fund, has built considerable capacity. Indeed, it was a lot of the HIV/AIDS platforms that were used during the pandemic to manage that crisis. So I think we should know that not only are we investing in ending an epidemic, we are investing in building up capacity. And that's really, really key. I think the third reason is that this is a real victory. This is a win for the United States and the world at a time when, frankly, we need one. And I think we can show that it is possible when people unite, put the resources on the table, have the discussions that need to be had, lead with science. We can defeat a virus as lethal and as fast spreading as HIV. And that's a great thing, especially coming out of a pandemic and given the health threats we know we'll face in the future. This is our example of what can be done.
And you mentioned, how much progress has been made towards winning this battle. And you also mentioned the populations that need to be reached still. You mentioned young women, you mentioned people in conflict zones. What are the practical steps that are being taken, need to be taken in order to get to those last populations? And, give us a sense of what kind of work is being done and can be done to get that last mile or last however many miles.
I think there are a few things. One, we're really fortunate that PEPFAR is led by a very smart and experienced friend and colleague named Dr. John Nkengasong, who's really looks at this from the two angles, all of it based in his considerable expertise in health. But one is, how do you get government policies and systems to work in these countries so that that is supporting the resources you're investing? How do you get a plan that will really deliver, and not only deliver against AIDS, but in so doing strengthen the health systems? The other is, how do you get the political will that is needed to do the final work? Because that's what it often takes. And, I look back to 20 years ago, and I think we all remember this time when a lot of people wouldn't even talk about HIV and AIDS. A lot of leaders around the world wouldn't talk about HIV and AIDS. I think what we've seen over the last 2 decades, particularly as governments have achieved success, is some really powerful and empowered ministers of health, heads of state who are willing to have the hard discussions and take the hard steps to get to those people that need to be reached. Now, it doesn't always work. In some cases, PEPFAR, the Global Fund, some of these programs are designing programs specifically designed to assist really young women and girls who are at very, very high risk. And sometimes that needs to be done very, very delicately and discreetly, right? Because you are threatening maybe, and they may be threatened by someone else. I think the communities develop those skills by now. But the important thing that needs to happen to get to the last phase of this is we've got to keep talking about it. The minute we send, or the world sends, the message that this is a problem that's been solved, the harder we make it for anybody in the field who's trying to get to those communities that still haven't been reached.
Mm-hmm. And on that point, you mentioned the pandemic in the context of the work that had been done on HIV and AIDS translating to the fight against COVID. Right. How did the pandemic impact what you're talking about now in terms of keeping attention on this? And are there any lessons that you took from the COVID fight now to the HIV AIDS fight?
Yeah, look, there's no question the pandemic set back some of the progress on HIV and AIDS. For understandable reasons, and it was made very much more difficult during lockdown. And people had to figure out alternative ways to get people their treatment supplies and medicines when people were on lockdown. Those things were eventually overcome, but some ground was lost. It's being picked up very, very quickly. I think there are a few lessons. One is that whatever the virus we may be fighting, whether it is COVID or HIV or Ebola, it's critical to have a strong primary healthcare foundation. And those foundations have been strengthened over the years, including by the investments made in the fight against HIV and AIDS, because that's taken the training of more personnel, the building of more capacity, the availability of more clinics, and so on. And that foundation has been critical to HIV and equally critical to COVID. So I think that's one lesson and one takeaway. I think the second is, and this is kind of a lesson in reverse. It might be a lesson that we could take from the fight against HIV/AIDS and apply, God forbid, should we ever face another pandemic like COVID. And that is the simple power of cooperation across the board, of communities coming together, of health professionals coming together. It's been that collaboration that has enabled the kind of outcomes that we've seen. And it's really key because as we saw in COVID, a lot of the response to COVID was politicized. In the early days of the HIV/AIDS epidemic, there was a lot of politicization of that virus. I think once the world kind of got its arms around it and really started the fight, that politicization ebbed. And it's been to the benefit, I think, of all of us and aided us in getting to where we are today. So that's one of the things that's, I think, a lesson from the fight against HIV/AIDS itself. It's been one of the biggest drivers of success.
And, last question as we wrap up, you mentioned several times the work that the U.S. has done leading this effort.
Yeah.
Can you talk a bit about the fact that at a time when the U.S. capacity to tackle global challenges seems in doubt, obviously this is one in which the U.S. really got its arms around it and made a big difference. Are there any, do you take heart from that, or what do you, what does that make you think in terms of the broader ability, whether it's in public health or elsewhere, for the U.S. To play this leadership role?
Well, I think it speaks to what's possible. Because what's happened here, we have had robust support financially and politically across multiple administrations, two political parties, the executive and legislative branches, and the public for 20 years. And that's done a number of things on the ground around the world. First of all, and I think sometimes we don't count this or see this, there are literally millions of people and over 5 million babies who are alive today because of that effort. And there are hundreds of millions more who know that it was largely the United States that took and sustained a leadership position to end this epidemic. And it may not all be translated today in every statement that's made, but that's really important. As I've traveled around the world and you hear that, that's certainly to their benefit. That's also, quite frankly, to ours. That's a really good look and a good stance for the United States. It's important that we lead in that way. I think the other signal that we've sent is that, particularly at a time when everybody in the world is watching everybody else's politics and so on, the fight against HIV and AIDS has been something in this country that has transcended politics in terms of how we've approached it globally. That sends a message as well. That our kind of common humanity, defeating a virus that, imagine if that virus had gone unchecked. It would have been far worse than anything we saw with COVID by a long shot. But that people coming together to do something big, and one president literally handing it to the next, and it continuing for 20 years, I think sends quite a message about one of the things that politics is about. It's about politics, but it's also about getting things done. And the politics in this have lined up to do really, really big things.
Got it. Well, Gail Smith, thank you so much for joining Axios.
It's my pleasure. Thanks.
All right. And next, over to Chris Freites for the next segment.
Hey, thanks, Dave. And thank you to our sponsor, Beatrice, for making this conversation possible. And joining me now is Beatrice's head of global policy, Erica Satterwhite. Erica, welcome to Axios.
Thank you so much, Chris.
So I'm excited to talk with you today. And I want to start with the big picture here. Where does the global fight against HIV and AIDS stand 20 years after PEPFAR?
Yeah, thanks so much, Chris. PEPFAR has been a huge success. Collectively, the global community has made such incredible progress in the ability to prevent and fight HIV When promptly diagnosed and initiated on treatment, HIV can be managed as a chronic condition, and people can lead long, healthy, fulfilling lives with essentially no risk of further transmitting the virus. According to UNAIDS, 75% of people living with HIV, nearly 30 million people, are accessing treatment today. 20 years ago, that would have been almost inconceivable. But the fight is not over. Averages can mask challenges, and there remain significant opportunities to help more people. In sub-Saharan Africa, 6 in 7 new HIV infections among adolescents is in girls. Every week in 2021, almost 5,000 young women became infected with HIV globally. And outside of sub-Saharan Africa, key populations in vulnerable communities still make up 94% of new HIV infections. Only half of children living with HIV can access treatment, compared with nearly 80% of adults.
So it sounds like we're really at an inflection point here in the fight against HIV. What are the biggest opportunities that you see?
There's a tremendous opportunity ahead of us to meaningfully advance the fight against HIV. The biggest question is that of continuing political will and commitment. There are so many other pressing health issues facing the world today, whether that's new pandemics, the staggering burden of non-communicable disease, or the rise of AMR. Fiscal space is constrained. Health budgets, both domestically and for international assistance, are too often seen as a cost and not as an investment. Many of those living with HIV who are not yet in care are marginalized, stigmatized, sometimes criminalized. The world still has the chance to end this epidemic, but the status quo is not going to be enough. This isn't only on the shoulders of governments, though. The public sector does have a critical role to play, including matching political will with financing. But communities, civil society, and NGOs also have a huge role, since many of those who are not yet enrolled in prevention and care services may not be best served by the formal health sector.
Yeah, I think you make a great point about we've come so far that it's easy to think that we're done. And I wonder, what can we learn from PEPFAR and the global response to the fight against HIV? I mean, what improvements can we still make despite the success we've seen?
Yeah, the biggest learning from the last 20 years of PEPFAR and the global fight against HIV/AIDS is that with political will, with targeted financing, accountable targets, and a true commitment to multi-sectoral partnership, including civil society, communities impacted by the diseases, and the private sector, the world can achieve incredible results. Imagine what more we can achieve across all aspects of health with similar levels of partnership and commitment. Of course, there's always room for improvement, and PEPFAR is no different. Congressional reauthorization this year gives us a great chance to reflect on the improvements that could be made to the program for even greater impact in the next 5 years. Expanding access to kids living with HIV, prioritizing clear demand forecasting for more predictable procurement policies to ensure sustainable access and manufacturing planning for the tens of millions of people who rely on treatment every day to stay healthy. And support for countries to build sustainable systems, including investments in local capacity to eventually transition away from needing PEPFAR support.
So I wonder, what is the outlook for the next decade? I think we all want to eradicate HIV/AIDS. Will we be able to say 10 years from now that we did it?
It's absolutely possible. The global community has proven time and again that working together, we can truly achieve that which seemed impossible. I think this is PEPFAR's greatest legacy. That said, it won't be easy. The challenges facing the global fight against HIV are truly immense, starting with the fact that there are so many competing priorities facing governments, all of which are incredibly important and interconnected. Ending AIDS requires a renewed commitment to partnership, to listening, to learning from people living with HIV about their needs, to supporting communities in delivering prevention and care, to incorporating the private sector as a partner in rolling out and developing solutions, and to working efficiently within, between, and across governments. And at the end of the day, ending AIDS really does need a healthy PEPFAR.
Absolutely. I wonder, we just have a few minutes left, Erica, and our audience, policymakers, decision makers, I wonder, what should they know about PEPFAR? What's the one thing you would like them, if they take nothing else away from today, what should they take away?
PEPFAR is partnership, and through partnership, we can truly achieve incredible progress. This is something we can end. We can end it together, and PEPFAR is absolutely essential to our ability to do that.
I think we can all take a lesson from the last 20 years. PEPFAR is a model for a global fight. It's something that should continue to be supported, and it's something that we can always improve on. Erica Satterwhite, we have to leave it there. She is the head of global policy for Viatris. Erica, thank you so much for joining Axios.
Thank you, Chris.
And now over to Adriel Bettelheim.
Thanks, Chris. I'm joined by Jennifer Cates, Senior Vice President and Director of the Global Health and HIV Policy Program at KFF. Welcome.
Hi, it's good to be here.
So PEPFAR, the President's Emergency Plan for AIDS Relief, has been by any measure a successful program for 20 years, but it's stuck in a difficult political moment. Help us understand some of the dynamics in play.
Yeah, so PEPFAR, as you mentioned, it's the U.S. Global AIDS Program. It was first created in 2003 by President George W. Bush. And by any measure, it had incredible, strong bipartisan support when it was created. And it has continued to have that over many years of funding, of reauthorization. So it was authorized and created, and then it was reauthorized. It's due to be reauthorized by the end of this fiscal year, and it's kind of stuck right now on the Hill because it's mired down in politics of the day. And it's not that this has not happened before, but politics are getting pretty messy. And so there's a question as to whether it's going to be reauthorized in time or by the end of this year at all, this go around.
So some conservative and anti-abortion groups, they say the program is being used to support abortion-related programs and NGOs that push radical agendas. How much is that criticism seeping into the debate, and is it having an effect on the reauthorization?
Well, that's exactly what's affecting this. So the history here is, first of all, when PEPFAR was first created, abortion politics played a role in that discussion early on. And there was bipartisan desire to create this new program, and so there was an agreement. Let's move forward. Let's save people's lives. And the latest account is, PEPFAR reports that it saved about 25 million lives, which is amazing. We've also analyzed this program and found it's had even effects beyond HIV, beyond health. So over time, there's still been that agreement, and when abortion politics have come up, it's been the legislation has been able to move through. Right now, as you mentioned, some groups have put forward claims that the program is supporting abortion. There's no evidence of that. In fact, there's lots of U.S. law and policy in place that prohibits the utilization of any U.S. money for abortion. Nothing has changed. PEPFAR hasn't changed that. It can't, not abide by that policy. It does. And so this is probably more about the current politics playing out in America and nearing an election year than anything about PEPFAR. But unfortunately, PEPFAR is becoming a bit of a victim to this larger debate.
Say PEPFAR isn't reauthorized, some parts of it will go away, but some parts could continue. Walk us through how that works.
Yeah, so I think, people hear it might not be reauthorized, and the first thought is, oh no, the program's going to end. That's actually not the case. Lots of the program, the main structures of the program are all permanent. They're in the law. However, what will happen if it's not reauthorized is there's a few things in it that are time bound, meaning in the legislation, it says these provisions will end by the end of this fiscal year. So if it's not reauthorized, they will go away. And those include things like earmarks for how much funding should go to treatment or how much funding should go to support orphans and vulnerable children. And a requirement that the U.S. government cannot provide more than a third of all contributions to the global fund to fight AIDS, TB, and malaria. It's actually a very popular position. It's been a provision. It's been used to leverage additional money. There's some others as well. So there's some time-bound provisions that do end if this isn't reauthorized, and Congress will have to decide if it wants to try to include those in an appropriations bill if it's not reauthorized. Beyond that, the program should continue. It is the case that Congress provides funding to many programs that don't have a reauthorization, but it could make the program a little bit more vulnerable to funding debates if it hasn't been reauthorized. And I think the last issue I just want to raise, it's really important to understand, this program has been reauthorized 3 times already. This would be the 4th. If it's not reauthorized, there's some concern it will send the message to those who benefit from it, mainly millions of people living in Africa, but in other places in the world, that this program is ending, even if that's not the case. And that is a risk because it could create a lot of challenges on the ground to continuing HIV programs.
So just to back up a little bit, the provision that would ensure the U.S. doesn't cover the entire bill, that could expire if there's no reauthorization this year?
That would 100% expire. It is a requirement that ends at the end of fiscal year 2023. Now, Congress could continue to put that provision, but it would in an appropriations bill, but that would have to be an annual thing. And so that has always been seen as a really important, you mentioned and I said, a leveraging tool to make sure that not the U.S. wasn't footing the whole bill and that others were stepping up and providing funding as well. And it's worked pretty well to date. So yes, that's one that it's an interesting one because it's supported by Republicans, Democrats, advocates, the Global Fund, and it would end for sure.
We've been focusing up to this point on the United States global AIDS program, but we still have HIV here in the United States. What are some of the broad trends you're seeing, and can you speak about some of the challenges that remain?
Yes, so yes, we do have HIV in the U.S. There were many years for which it was pretty, the progress was stagnating. And a few years ago, the federal government under the Trump administration actually launched a new initiative called Ending the HIV Epidemic Initiative to try to address this. And the Biden administration has continued, and it's attempting to have a more focused, concentrated effort in the hardest hit places to drive change. It's been tough. I mean, we've all just lived through COVID, and that has meant that some of the progress that was starting to be seen or could have been seen, it was slowing. So in the US, we have an epidemic that's really concentrated. It's mostly affecting gay and bisexual men and other men who have sex with men. It's mostly affecting people of color. It's not spread across the general population, but it's really highly concentrated in hard-hit communities. So that's one. But speaking more broadly, if you look at the US compared to our peers, the European countries, Canada, Australia, we are performing much worse than any of those countries. For example, viral suppression, which is sort of a gold standard measure. If the virus is suppressed in your body, you're not going to pass on HIV. The share of people in the U.S. that are virally suppressed is much, much lower than the share of all of our peer countries. So the U.S. is really, I think, hasn't caught up yet to the rest of the world and in fact, even some of the countries that it supports efforts in on the global side.
There's skepticism about the ability to reach the stated goal of reducing new infections by 90% by the end of this decade. Is that feeling because of the difficulty of getting to hard to reach populations like you were talking about? Is it a money problem? Is it kind of bureaucratic red tape, restrictions on how the money is spent? Where is that coming from?
It's a little bit all of the above. So it's a hard goal. As you mentioned, some of the populations we're talking about have already been highly stigmatized, do not have access to information, to care, or at least sufficient care that they would need. And so reaching people that are already have been pushed aside or made to not feel welcome is tough. But in addition, funding is an issue. There's been additional funding provided, but it's not clear that's sort of a game-changing amount. And then I think, you hinted at it, what really probably could drive change is if things are done differently. And right now, the way that most of the programs for HIV in the US, as many public health programs work, the federal government provides states and local jurisdictions with funding, and then they sort of customize what they're going to do within federal guidelines. So that creates a lot of localization, which can be good in meeting specific needs of a community, but it also means it's hard. The federal government isn't sort of pushing the latest sort of all the guidelines down. And so I think it's all of the above: funding, focus, and then realizing this is a long haul challenge.
So some of the money is not reaching kind of the end source, the local agencies?
So it really depends. I mean, there's already an example of one state that said they didn't want to take some of the money because of some of the federal policies around supporting certain populations, and they wanted to decide who to fund and support for HIV intervention. So there's a little bit of that, but it's sort of think think back to COVID, where we had a lot of challenges with federal-state relationships and who's going to call the shots and who's going to make decisions. And that happens throughout public health. There's amazing committed public health and HIV leaders throughout the country. But I think, trying to change the way of doing business on the ground at every local jurisdiction is tough. And that's one of the challenges that we see. One other I'll just mention, there's been a real desire and some efforts to try to increase uptake of PrEP, pre-exposure prophylaxis, because it's so highly effective. If you are a high-risk person and you take PrEP, you're not going to get infected with HIV if you get exposed. And so it sounds like a no-brainer, but it's been very hard to scale up. And part of that is related to our insurance system and challenges that we've had with payers. Some of that has been addressed, but it's been a long road to get there.
Jennifer Cates, thanks so much for joining Axios.
Thanks so much for having me.
Thank you all for joining us this afternoon for another virtual conversation that has made everyone smarter, faster. For more information or to sign up for the Axios Vitals newsletter, visit axios.com/newsletters or the Axios app. Thank you all for joining, and we'll see you soon on axios.com.